Good morning and good afternoon, everyone. This is Rudy Inaba. I am Cenegenics Global Director for Nutrition and Exercise. And today we will be going over how to understand food sensitivities as well as food allergies. So I'd like to start off with a quote for most of our webinars. This is from Virginia Woolf. I think I have the spelling of her last name wrong. I apologize. It is, "One cannot think well, love well, sleep well if one has not dined well." And I believe this quote was made in reference to just enjoying the food that you're eating, so that makes you happy and you can do all these other things. But take it out of context and actually looking a little bit more seriously, it also holds true. If you are not eating well, you're eating poor quality foods that can really disrupt your digestive health. Our gut health and our digestive health is so important that if we actually start to have issues with our gut health from eating poor quality foods year over year, decade over decade, that can in fact affect how we think, that can affect how we feel, and that can affect how we sleep. And over time, that can really change how we live. So some food allergy statistics. Food allergies affect 32 million people in the US annually. Every 3 minutes, a food allergy reaction is responsible for sending someone to the emergency room. Food allergies can start either in early childhood or even as an adult. Roughly 6 to 8% of children have food allergies. Roughly 2.5 to 3% of adults have food allergies, and some children can potentially outgrow them over time. As an adult, prior to having children, when I would hear food allergies, I thought some of the more minor effects, eczema, skin issues, digestive issues. However, now that I'm a parent, I do notice that some food allergies are potentially very serious for children and adults, and they are even life-threatening. So what we're going to be going over today, and I'm going to give some information so that we don't mix up a lot of verbiage, but we're going to be talking about food allergies, food sensitivities, and briefly touch on food intolerances. And food allergies are an immunologic hypersensitivity, and they're represented as immunoglobulin E, so IgE. Food sensitivities are immunologic delayed reactions to food. So whereas an allergy is an immediate reaction, a food sensitivity is more of a delayed reaction. And those are represented by immunoglobulin G and also A, so IgG and IgA. For this conversation, we're mostly going to be going over IgG. And food intolerances like lactose intolerance, for example, that is a non-immunologic reaction to food. So that reaction that maybe someone has from having dairy or lactose, or they have disrupted stomach or gas or bloating, that is a reaction, but it's not affecting by the immune system. So immunoglobulins are antibodies that are produced by the immune system to fight off antigens. And they are made in response to things that our body recognizes as potentially foreign. So things like bacteria, viral cells, pet dander, dust, pollen, but also food. And different immunoglobulins actually fight against different threats. So as we mentioned, IgEs, or immunoglobulin Es, are immediate responses to a foreign threat. In this case, it would be a food allergy. Whereas IgG, immunoglobulin G, is less aggressive, more subtle, and typically longer lasting than an IgE. So what is a food allergy? And food allergy is by definition an immune system reaction that occurs soon after consuming a certain food. Any amount can trigger the signs and symptoms of this allergic reaction, and that can range from digestive issues to hives, irritations, swollen airways, anaphylactic shock. This can be influenced by family history, but it also might not be. Those with other allergic reactions are also at greater risk of having food allergies. So if someone has eczema or hay fever or asthma, they are potentially at increased risk for having these food allergies and even sensitivities. There's no real cure for a food allergy. In most cases, it is avoiding those actual trigger foods that cause those allergic reactions. In more minor cases where it's maybe more skin irritant or hives, antihistamine drugs can be used for mild reactions. Whereas if something is very severe and it's causing airways to become swollen and the inability to breathe, epinephrine injections and ER care are necessary for severe reactions, as it can potentially be slipping into a coma and go unconscious. So IgE allergies, they are the immediate responses to the antigen that has entered the body. And these symptoms, again, these are immediate. So these occur in either seconds or minutes. And a good example is looking at either like wheat or cow's milk. And again, don't get the cow's milk confused with lactose and having that food intolerance. But if someone has an allergy, an actual allergy to wheat or cow's milk, and it's consumed in someone that has a defined IgE allergy, the body's actually going to see wheat or cow's milk as a toxin, and it makes these antibodies, these IgEs, and it binds to the food. So after the exposure, the IgE antibodies then attach to mast cells until the next exposure. And when they're exposed again, those IgE antibodies will have mast cells send histamine and others in reaction to the exposure. And that reaction causes inflammation, itching, or other potential symptoms. So with actual food allergies, to avoid this from happening and from developing and getting worse and worse, complete elimination of these IgE allergies are recommended. So the most common IgE food allergies, 90% of all emergency room reactions from foods are in the picture right there. So milk, tree nuts, peanuts, shellfish, fish, egg, and soy and wheat. So again, those are responsible for 90% of the food allergy reactions. With Cenegenics, our testing that we do for food allergy and food sensitivity, the basic 12 IgE foods that are associated with allergies include almonds, whole eggs, cow's milk, peanuts, sesame, shrimp, soybeans, tuna, wheat, all these that are the top 8, but also things like beef, oranges, and tomatoes. So these IgE symptoms, these actual food allergy reactions, are immediate. It can be inflammation, it can be swelling, it can be hives or eczema, abnormal itching of the skin, changes in breathing, either rapid breathing or slowed breathing, changes in swallowing, so feeling like your airways are getting closed, and as I mentioned earlier, the anaphylactic shock. So while true food allergies are commonly limited to the foods that we just discussed, food sensitivities or intolerances can occur from really a number of foods. So we're going to get into that in just a little bit. So food sensitivities are very interesting because many people with IgG, so going back, let me step back a little bit. So we talked about IgE being food allergies. Now we're talking about immunoglobulin G, so IgG, and these are associated with more food sensitivities. So people with IgG food sensitivities, in many cases, don't know that they have them. They are minor, subtle responses that may go unnoticed or become the norm for someone, or someone may be experiencing these symptoms, and because it's not like a major disruption to their day or to how they feel, they could associate those symptoms to something else, or maybe they're just not really feeling very good, and they don't really tie it to some of these minor, potentially even, classically healthy foods. So IgG allergies or sensitivities are delayed responses to an antigen that has entered the body. These symptoms can occur anywhere up to 2 or even 3 days after consumption of this antigen or of this food. And IgG antibodies can lead to a heightened inflammatory process. So when we have these foods, we might not have that immediate rash or closing of our airways, but our body's going to start to have some more inflammation. Sometimes we can feel in the joints, sometimes we just don't feel too good, maybe irritable bowel syndrome. But clinical data suggests that the elimination of the foods that cause this IgG reaction or this sensitivity can actually improve or lessen symptoms of irritable bowel syndrome, rheumatoid arthritis, cystic fibrosis, ADHD, and even epilepsy. Now, I'm not trying to make massive claims on the role of IgG foods, but when we look at these studies are actually looking at the symptoms, and how aggressive those symptoms are in individuals and where they can change and fall on the spectrum. So if someone is able to remove a majority of these IgG sensitivities, that can improve their symptoms of IBS, that can improve maybe the frequency of epileptic seizures in these studies. We're not saying we're curing these, but we're saying that having this information is really beneficial for those with these disorders, as we can start to lessen those symptoms. So IgG symptoms, again, these are not associated with the release of histamine, so they're not immediate reactions. These are more delayed reactions. Again, 2 to 3 days after exposure, but they can cause changes to our cognitive health, so anxiety and depression, our GI or our common things that we feel, the diarrhea, constipation, nausea, gas and bloating, fatigue, brain fog, weakness, really kind of lack of motivation, mood changes where you're just not feeling well, just kind of like feeling under the weather. Chronic conditions, having chronic exposure of these foods and unknowingly consuming them that are causing all these inflammatory responses that are kind of low grade, that can lead to the development of chronic inflammatory conditions. And that's including but not limited to things like arthritis, ear infections, eczema, asthma, colitis, IBS, migraines, and even leaky gut. And leaky gut is a common thing that we've been seeing a lot in media. A lot of people are talking about it because we're now learning more and more about our gut health and our second genome, so to speak, and our gut microbiome. So I want to just have a slide on leaky gut. So leaky gut is a thing, it's considered intestinal hyperpermeability and other digestive issues that can be associated with IgG food sensitivities. So our digestive system is protective, but it's also permeable, and it's permeable for a reason. So the walls of our intestines act as barriers that have small gaps called tight junctions, and those gaps allow water and nutrients to pass to get into the bloodstream. So we need to have intestinal permeability. That's going to allow, but having hyperpermeability, that can inhibit some of the functions of the intestinal barriers. Our walls also block the passage of food particles, bacteria, toxins, all these things from reaching the bloodstream and triggering the immune system response. So normal permeability is good. We want to have that so that we can allow the water and nutrients to pass. But hyperpermeability, we can then start to have food particles and bacteria that are going to start to trigger that immune response. So the loosening of these tight junctions can increase as we start to expose ourselves to more of these IgG food sensitivities. And as those junctions loosen and those microscopic holes become bigger, that's really going to increase our chronic inflammation. So chronic prolonged inflammation and toxicity can actually increase these risk factors of even autoimmune disease and other related diseases. As a side note, I did talk in one of our previous conversations with some team members. At Cenegenics, we have one of the big products that's out there that a lot of people are using in the retail market are collagen products. And collagen products are fantastic. There's a lot of data behind them. But one thing people need to understand is that the particle size is important for collagen products, because if the particle sizes are too big, the collagen product cannot actually get through healthy, tight junctions in the intestinal wall and get into the body and absorbed. So you want to have small particles, and that's why Cenegenics Regenerate product, our collagen product, actually has particle sizes that are about a quarter the size of some of the leading retail products. So if you're interested in a collagen product or you take one, these fine tuning of our formulas include all these things that are considering these anatomical components of our digestive tract. And food intolerances that I mentioned. So food intolerances, they do not trigger the immune system, but they can potentiate similar symptoms. So as I mentioned earlier, having a cow's milk allergy is a true immunologic allergy, but having lactose intolerance is a little bit different. So you're not actually having that immune system response. It can be caused by deficiencies or an absence of enzymes that are needed to aid the digestion of these foods. And again, the common one is lactose. So if someone doesn't have enough lactase, so their body doesn't produce a lot of lactase, they're going to have a hard time breaking down lactose, being the milk sugar. So when they eat ice cream, or if they drink milk, or if they eat yogurt, they're going to notice that they may experience gas or bloating or diarrhea. However, they may also find that if they do something where if they eat like a plain Greek yogurt that has low sugar, or if they have certain foods, if they have cheeses, they're going to be fine. So it's not that the milk is causing them to have this reaction; it's the milk sugar, since cheeses and more of the strained Greek yogurts aren't going to have as much lactose in them. So again, small amounts may be consumed if you're also providing that supplemental enzymatic support. There's products out there like lactase that you can take maybe 10 to 15 minutes prior to eating some form of lactose. A lot of times people will do like an ice cream kind of thing. If they want a dessert, they'll prepare themselves for that so they're not upset, their stomach's upset. So as with anything, how do we start to integrate this information into our lives? And as an action plan, I do suggest that, avoiding IgE, that actual food allergies, so that we can prevent acute and potentially dangerous events from occurring. Again, it can be minor, it can be skin irritations, it can be changes in breathing. However, if you are going to consume, a known allergy, that can be serious impact to your health. There's one of my colleagues' wives had an allergy to a certain wood, I believe, and unknowingly, and they were at they had a campfire and they started burning this wood, and she started to feel her passageways closing, so they had to rush to the emergency room. So, try to avoid those things as much as possible. Also, it'd be good to incorporate an elimination diet, removing those IgG foods, so removing the food sensitivity foods for a length of time, roughly around 90 days. And in those 90 days, while we're removing those foods, you want to incorporate strategies to really heal your gut and strengthen your immune system. So things like antacids or non-steroidal anti-inflammatories, antibiotics, If those things are taken long-term and regularly, those can really disrupt the good quality bacteria we have in our guts. So we want to try to remove those as much as possible, whether it be through changes in our lifestyle so that we don't really need them, or we maybe hold until we are, we stop an infection and we run our antibiotics course. But, removing those items, removing known allergens and known IgG food sensitivities, and removing just junky food, food that is not nutrient dense, that does not have a lot of vitamins and minerals, that's not really providing us with a lot of positive things for our health. By taking all of that out, we're going to be able to start to improve our gut bacteria. We also want to incorporate some needed enzymes if we're lacking there, also fiber and even prebiotics. But we also want to build up new good bacteria as well. So we're going to be able to do that with high quality foods, but also by including things like a good multi-strain probiotic can be beneficial. When you're looking at probiotics, having one big amount of a single probiotic can be beneficial. However, it's going to be isolated within certain areas of the GI tract. If you're looking for more multi-strain probiotics, it'll be able to colonize the gut in a magnitude of areas. So looking for something that's a little bit multi-strain and then doing that for some time and then pulling away from it. It's not something that may not be needed full time. And we also want to repair the gut lining with things like essential fatty acids through diet and also potentially through supplements, zinc, and even glutamine. So glutamine is commonly known in the sports nutrition world for improving rate of recovery. And it also goes along with our gut lining. And, really, is it potentially improving athletic performance by enhancing recovery because we're having better gut lining and having better digestion and getting more nutrients out of our food? So which one comes first? After doing all this for about that 90 days and avoiding those foods, you can consider retesting your food sensitivities, so the IgGs, to see if they're still sensitive over time. And after the gut health has been restored, maybe we can have some different results. But if that's the case, you can slowly reintroduce some of the lower sensitivity foods, as you may be able to consume them now in moderation. So Cenegenics does offer food allergy and sensitivity testing to our patients with a variety of options, looking at IgE, IgG. We do have some IgAs and even things like a candida profile that we're not going to get into today. Here's an example of the list of the 96 IgG food panel. So these are all the foods that are potential for food sensitivities. This is one of the standard IgG food panels that we'll do on our patients. Many of these foods are commonly healthy foods. It's not that they are bad foods if you have a sensitivity to them. It just could be that it's your immune system response. In cases, someone who's frequently consuming a certain food over and over and over again may over time start to develop a minor sensitivity to this food. If we pull it away a little bit and we retest, they're going to be able to consume that without that inflammatory immune system response. So that's why food variation is also really important too from a day-to-day basis. So that's our 96 IgG food panel. Taking a look next, we have our 184 IgG comprehensive food panel. So we combine all of our IgG testing with our 12 IgE testing that I mentioned, those big ones that are causing that actual true allergic response. But this is the full list. If someone is interested in doing food allergy and sensitivity testing, the 184 IgG combined with the 12 IgE is really what is most utilized within our patient base and within our practices. And we'll be able to find out that information, once our patients complete it. This is a cool example. So to the left, we see the report from the basic IgE, so the actual food allergy results. And on the right, I isolated the component of the IgG testing to just the nuts, seeds, and oils component. So if you see on the IgE testing, everything is basically zero. So everything is almost less than 0.10, except for we have shrimp that was at 0.11. So literally 1/100th of a point over what's considered, a normal non-allergy score. So because it's just barely over that range, it's classified as a 0/1 category of allergy. So it can be avoided. And I wouldn't, you have to see for the patient. Everyone's going to be different to be how aggressive as it would be. But if someone's going to go into anaphylactic shock from shellfish, they're probably going to be more like a class 2, 3, or even higher. So for someone who's maybe has cross-contamination, they might get some kind of exposure to shrimp, but it might not be so severe at this low of a level. But what I wanted to point out is if you take a look at almonds. So with almonds, lowest IgE score classified as 0, so not allergic to almonds. However, when we look at the IgG, the food sensitivities, the almonds are actually redlined and they're categorized as a 2. So with the IgG food sensitivities, we have categories 0, which are no food sensitivity, number 1 out of 3, 2 out of 3, and then 3 out of 3. So 3 out of 3 foods we absolutely want to avoid. 2s we want to avoid as much as possible. There may be some cross-contamination. But the interesting thing is here is that, there's not an actual allergy. So someone could be eating almonds on a daily basis. I mean, I know plenty of people, my bodybuilder friends that, one of their meals during the day are a protein shake and an apple or an orange and, 2 handfuls of almonds. They're not going to be breaking out in hives or having allergic reactions because this, we don't have a food allergy here for almonds. However, they could be having consistent low-grade inflammation from this response, from this IgG food that they, really shouldn't be consuming. So having this kind of information is really beneficial because not only does it suggest that they need to rotate in certain foods, but also they say, you can take a look at things like, why don't you incorporate some walnuts for the next 90 days? And let's retest and see if you're okay with almonds and cashews and see how those improve. So it just goes to show that we can, go days and months and years and decades consuming foods that aren't giving us this immediate allergic response where we're not really paying attention to it. But we might just feel a little, for lack of a better word, just kind of crummy and not very good on a day-to-day basis, eating some of these really common foods that we associate with, better health. So that's why this test is really interesting and important for a lot of patients that are looking for some more in-depth answers. So for the reporting, a serum sample is collected by one of the Cenegenics phlebotomists. So just as with any lab draw at Cenegenics, our phlebotomy network comes to you either in your home or office to do the blood draw. We'll get the complete lab analysis probably within a couple weeks, and it is reviewed by our Cenegenics physician and our clinical team. The Cenegenics physician and the Cenegenics nutrition exercise team members within that center, and also through other centers, can work together to really strategize a plan for our patients to really implement different foods, reintroduce them if we're going to be doing an elimination diet. And if we wanted to look a little bit further, a good complementary test to do alongside the food allergy and sensitivity testing is micronutrient testing. We're not going to get into that today, but the micronutrient testing is great because it allows us to see our essential fatty acids, if we're low in B vitamins, just kind of really see what our levels are. So if there's something that we need to integrate from a nutraceutical, we can implement that. But also if someone has, potentially leaky gut and we need to restore gut health, and they also have very low levels of zinc, we know that we need to have more zinc-rich foods from a day-to-day basis. And potentially if it's very low, we can even use a nutraceutical to help bring zinc levels up. So it can be very fine-tuned for the individual. And again, comprehensive male and female panels that we draw on our patients, not only at baseline, but at our first initial follow-up and every quarter after that, so that we can see how these changes are impacting inflammatory markers like high sensitivity C-reactive protein that I know we've talked about in previous webinars. It can also look at other markers that are associated with inflammation in the body. So what can you do now? So number one thing is to maximize gut health with the action plan that we just talked about. So remove low nutrient foods. So if the foods aren't really doing anything for you as far as providing you with high quality phytonutrients, things like fiber, antioxidants, we want to remove those poor quality foods. We want to remove allergens and also foods that you may be sensitive to. And potentially, if we can do it, antacids, non-steroidal anti-inflammatories, and also antibiotics. Obviously, speak to your physician or your clinical practice on ways to do that. Incorporate enzymes if you feel that you need them. Fiber, include prebiotics. Build a good gut bacteria, with a multi-strain probiotic, and start to repair your gut lining with essential fatty acids, zinc, and glutamine. It's an interesting concept because a lot of people think that, calories in and calories out is the only way to lose weight. But if we are consuming foods and we have a disrupted GI tract and our gut health is not good, that can really significantly impact our fat loss or weight loss efforts. So actually next week, we're going to include a little bit more on gut health into the next week's webinar, which is surprising reasons that you can't lose weight. And just to remember that the gut wall, that gut lining we have, it houses 70% of the cells that make up our immune system. So it's extremely important. There's 500 species and even 3 pounds of bacteria that are housed in our gut. So we really need to manage our gut health to really not only improve our weight loss efforts, but just our general health, because all of it stems from our gut. One thing to remember is that our gut health is impacted with every bite of food that we eat. So every single time we eat a meal, we can make a difference. So there's no better time to start than now to start consuming nutrient-dense foods and build a healthier gut. So again, our next webinar is November 7th at same time, 11 a.m. Pacific, where we will be going over the surprising reasons you may not be losing weight. If you have any questions, we're happy to take your questions at this time. And as always, if you have any questions after the webinar, you can feel free to reach our team at 866-240-0035, or you can contact me directly on that bottom line phone number. So one question we have is, can you touch base again on why identifying food allergies can be so important and why chronic inflammation is so dangerous? So food allergies, so our IgE is extremely important because those are those foods that are triggering immediate immune responses. So again, it can be something minor like, some skin irritations, but it can be something far more severe like the closing of airways and anaphylactic shock. So really, that's why it's so important to identify those food allergies, because it can be, potentially life-threatening. And in many cases, as an adult, you're very well been exposed to those 8 foods or those 12 foods we talked about. So if you haven't, again, not to be insensitive, but if you haven't died from eating those foods as an adult, you probably don't have an IgE food allergy from them. However, the IgGs are going to be interesting to see. So why is chronic inflammation so dangerous is that, if we have foods that we are sensitive to that are IgG foods, so those long lists of potential items, if we're yielding an inflammatory response by consuming these, that can inflame the gut, that can cause more inflammation, through the vascular system. And over time, that can lead to things like heart disease can develop, that can lead to things like neurodegeneration. So we had an Alzheimer's talk a few weeks ago. Managing inflammation is going to be highly important for that. Type 2 diabetes can stem from inflammation. Really, many chronic illnesses are going to be stemming from low-grade chronic inflammation that are measured by things like our high sensitivity C-reactive proteins. So by looking at these lab values consistently and reducing our exposure to these foods and really just in general lifestyle altogether that are creating an inflammatory response that's not necessary, that are ways to really significantly improve our health. How do I know if I need to be tested for a food allergy or if it might be something else? Again, really, it's always better to be safe and get the allergy testing done. If you've eaten a certain food and you see this triggered response and it's repeatable, and it comes to the point where it's a reliable and valid reaction where every time you consume this food, without question, something is occurring. It's very likely a potential allergy, but you never know. It could just be a very strong sensitivity. Really, the best way to get clarification is by doing this testing. The easy answer is just to avoid those foods altogether that are repeatedly yielding that response. However, if you're looking to get a little bit more in-depth information, that would be something that the test would provide. Do you see sensitivities to stevia? Some individuals, yes. I think it would be more intolerances. Stevia, when you break it down and you look into more of the supplement market, there's a certain form of stevia that some people have issues with. It's not so much that stevia in general across the board have a food sensitivity to the stevia plant or the leaf. However, they could have some from the more stevia that's grown really for nutraceuticals and for like food grade stuff, like stuff that's not caught in nature or grown in nature, essentially. One thing as an alternative, if someone does have a sensitivity or an intolerance, we do monk fruit. Monk fruit is also kind of a more newly used natural sweetener that is non-caloric. So a good example is our pre-workout formula, our post-workout formula. So Power, Recovery, and our whey proteins use a combined amount of natural stevia and also monk fruit as a way to reduce the amount of stevia we're using per serving. How often do I get retested for food allergies? So food allergies, you don't really need to retest extremely often. If you have a known food allergy, you very well likely are going to maintain that. It might change to a degree over time. So if you want to see the changes, you can repeat those tests. We're talking food allergy with an actual IgE food allergy, you're going to be removing those foods as much as possible, if not completely eliminating them. So those, maybe you can retest them every 6 months to a year if necessary. The ones that I think you'd be more beneficial to retest on a 3-month, 6-month, or 9-month basis, whatever it may be, are the IgGs, which are those food sensitivities, as those are the ones where we might not be associating those minor symptoms to the foods that we're consuming. And also, we don't really have a whole lot of clarity of what's going on. If I have a shellfish allergy and I go to a restaurant and I eat a piece of shrimp, I'm going to have an immediate reaction. So there's a short window of time where I ate something and I can really put my finger on what that food was. If we're talking with IgG food sensitivities, that there could be 3 days after the fact that I've consumed this potentially, triggering food where I'm getting these symptoms. I mean, I eat 5-6 times a day, even people that are eating 2 meals a day, after 3 days worth of eating, you don't really know what could have caused that response. So that's why, getting the food sensitivity testing done on a little bit more frequent basis could be more beneficial. So my 24-year-old son has been having abdominal pain for months and has been taking prebiotics and probiotics and other supplements. Is food allergy testing the only option? It's not the only option. Really, I think if you were to go speak to a physician or a naturopath or functional doctor, they'll probably do an elimination diet first, where they're going to remove all of those allergy foods, those, frequent allergy foods, and cut those out first and start to keep a food log on a regular basis and a scale of how you're feeling after each meal and how you're feeling at the end of the day, and do that potentially for 3 months. It's tough. I mean, especially as a male in his, mid-20s, keeping a food log like that could be a tough thing to do. But, if he's having significant symptoms, the elimination diet would help. And then over time, he'd start to be able to kind of associate what kind of trigger foods are causing this. Because the food allergy, you can do the testing and you'd have some answers. However, doing the elimination diet along with that could be more of a subjective way to kind of see what things are going on. So I'd either say either the food allergy or the food sensitivity testing combined, or just doing an elimination diet where, if he wants to be safe, removing those big 8 items, even those big 12 items that we discussed earlier, and keeping track of that over the next 3 months, 12 weeks, whatever it may be, and seeing how that's improved. Again, the other thing, the prebiotics are great. The probiotics, you want to focus on having one that is more clinical grade. So like, for example, Cenegenics probiotics, we have, I believe, 3 or 4 in our formulary. And they range from 30 billion CFUs in a single dose that's taken daily. We have a 100 billion CFU that's either taken daily and then walked down to maybe 2 to 3 times per week. And we also have a 350 billion CFU that is used for someone who has more like Crohn's, colitis, more significant GI disorders. So sometimes when you go to Whole Foods or the vitamin store, you might be finding products that are only maybe like 1 million CFU or something low like that. You want to be able to make sure that you're getting enough and also having multiple strains. It's not a magic pill by any means, so there's a number of things you can do, but having that included is going to be beneficial. So I really hope the best, for your son, that you can figure that out. But I would start with the food log, and then kind of just checking on your probiotics, and also seeing if the food allergy and the food sensitivity could be beneficial to kind of help him out. So one is a question about food sensitivities causing symptoms like muscle tension, chronic muscle tension. It's possible. We can respond a lot differently to a lot of different foods based on severity and how everyone's feeling. So while the list, is the more common symptoms we'll see from food sensitivities or food allergies, it's not completely extensive. I mean, there are other things that can be happening for the individual. With that, it's tough because with chronic muscle tension, if you are active and you're exercising, there are so many factors that could be associated with things that are causing that symptom, whether it be like maybe performing a movement in a slightly different way, maybe having issues with recovery, but it could absolutely be something like strong food sensitivity over time. So, if you've been eliminating so many foods, it might be beneficial to do that testing just to even rule it out. And then you can maybe move on to something if it's more biomechanics involved. That's associated with, the type of movement that you're doing, whether it be, even if it's activity, whether you're walking or doing things along those lines, if your gait is disrupted, or it could be something with how you're moving, all those things can factor into kind of that muscular change. So I can't put a pin on it. I don't want to give you a direct answer on this webinar, but I would look at some of the testing that you can do, whether it be, through Cenegenics or other things, or, kind of finding ways to eliminate some certain things that could be causing those issues, to check them off and then move on to the next culprit. Let's see. And one question is food testing part of the initial elite health evaluation at Cenegenics? And the answer is no. So we do our comprehensive male and female profiles for all of our patients coming in. And to be honest, the evaluation day is a long day for our patients. It's a 6 to 7 hour evaluation where we go over a number of diagnostic assessments. So DEXA scan analysis for bone mineral density, body fat percentage, how much muscle tissue we have, where we actually store it and have a good amount. We're also looking at any kind of postural deviations we have through our functional movement patterns. We do our exercise testing, so cardiopulmonary efficiency through VO2 max test, how well our heart, muscles, and lungs work together. We do strength testing, endurance testing. We do our cognitive testing. So already we have so much testing going on. And then when we meet with our physicians, we spend roughly 2 to even 3 hours with our doctors to go over all of the data, all of the labs that we're doing. We're looking at, roughly a little bit more than 100 different lab values from our comprehensive panel, but then also tying in all the values we've collected from our VO2 tests and all of our other diagnostics. It's not like we only look at just one VO2 test score. We look to see how we've progressed through that actual exercise test and see how our heart and lungs are progressing over that, time period. So we're looking at a ton of data. And for many of our patients, incorporating the more optimal lifestyles we'll put together with nutrition and exercise, we're really, again, I've said it before, let's pick the low-hanging fruit maybe in the beginning, because there's so many positive things we can change in an individual's life that they're not doing yet. So let's start there. And if some things are maybe not improving as quickly as, we've expected or that the patients have hoped for, and we want to say, all right, let's dig a little bit deeper, let's go next level down, that's when we will implement more of the food allergy and sensitivity testing and also the micronutrient testing. So that's more of the case, and the structure for the majority of our patients is that, for our next level, we'll kind of integrate that next level of data if it's needed. But some patients want to get all the testing done right off the bat, have it all laid out on the table, and have a clear understanding of what is going on, in as much depth as we can provide. And there are some patients that do that. So as our standard practice, it is not included in the elite health evaluation unless it's added on. However, it can be added on at any time by any of our patients at any of our centers. Another question that we covered, how often should I retest? Again, for the IgG, the food sensitivities, if you've been doing an elimination diet and you've also been, including different nutraceuticals and ways to improve your gut health and your gut lining, we could retest probably at 90 days for the IgG. It could even be stretched out. It really just depends on how much information you want to know and what kind of symptoms that you're presenting with. Well, those are all the questions that I see for today. I want to thank everyone again for joining today's webinar. I hope it was informative. I hope you learned something. And as I mentioned earlier, next week on Thursday, November 7th, I will be hosting some surprising reasons why you may not be losing weight, where we're going to get into some of the information that is commonly overlooked in a fat loss goal or a weight loss goal. So thank you everyone for your time, and have a great day.